I think the first thing to say is that the primitive reflexes are normal. They're good to have at an early age. So if we get Annabelle now, our little baby, should have these reflexes when they're born, and it's all to do with survival. Some of them help them kind of wiggle through the birth canal. Others are helping be aware when they're distressed, or then beginning to grasp and involved with feeding. So they're good things, but they are reflexes that are happening low down in kind of spinal cord and brainstem.
Okay.
And so as the brain then develops, they should override these. And you don't want to have these reflexive movements going with you through life, or particularly the autonomic reflexive things where you suddenly go into fight, flight without even realising what's set it
and
off.
that's the sort of startle reflex,
so yes,
is it?
The startle reflex there, that's right. And with that, so the Moro we're talking about there, the children can very easily get upset. Now, they're getting upset in a subconscious way, and then that's triggering their behaviour. So then they're either flying off the handle and being aggressive, or they're overwhelmed and running away. And they don't really know why they're doing it at the time. It's something that they might consider a little bit afterwards, but it's still a reflex.
And so that example would be where that primitive Moro reflex hasn't been sort of subsumed or overridden.
That's correct, yes. We need areas of the cortex to begin to inhibit. As our brain develops, then it can inhibit a lot of these subcortical, more subconscious areas. And sadly, most of the children I see haven't done that. So they might be at school and they're trying to do cognitive learning, but they're unable to inhibit these, which is then impacting a lot on their learning and emotional state.
Okay. If we were to just mention the other key reflexes?
Yes, we've got plantar and Babinski in the feet. So we've got a plantar one along here and a Babinski up here. And they're kind of helping baby propel themselves forwards, so being able to feel forwards and back with the feet, and also then the Babinski more on the inside and outside. So they're using these for stability and propulsion, getting the control. So as they begin to wait there, they've kind of still got some of the reflexes, but then they get more proprioception and movement through them. Stimulates the brain more, and that then begins to inhibit them, so they've got more control. They can decide exactly how they want to move, spring, run, land, rather than be sort of compelled by the reflexes. In the hands, we've got the grasp, so as putting pressure here, then you go to grasp. And again, that's useful at first, but then you want to begin to be able to inhibit that and use little bits of it, and then
so
be
the
doing
small
things
motor,
with handwriting, and so the fine motor control there. And then we've got the routine and the suck reflex around the face, which are helping the feeding and swallowing. But again, if they stay there, we tend to see a lot of hypersensitivity. Well, in all of these, you get hypersensitivity or lack of sensory awareness.